Thanks very much to Michael. To Aunty Joy, it is our privilege and honour to have you speak on behalf of Australia. And it is my privilege and honour to have as my partner in the Health Ministry, Ken Wyatt. For those of you who don't know, Ken was the first Indigenous member of the House of Representatives of the Australian Parliament. He is now also the first and long overdue Indigenous Minister in Australia, and he has responsibility for Indigenous health. So we are thrilled to have him. And Aunty Joy, you speak for Indigenous Australia, and he speaks for Indigenous Australia within the ministry and as his passion for Indigenous health. I want to also, though, to say to Michael Moore, as the President of the World Federation of Public Health Associations, you are a force of nature, along with Bettina as Executive Director, and we're privileged to have both of you. To Professor Helen Kelleher, the Congress convener, who comes from my own area, we're all privileged to have somebody such as her. But above all else, and I also acknowledge the Victorian Minister Martin Foley, to the 2,700 delegates from 83 countries who have come to Melbourne, welcome. Welcome to the 50th anniversary of the World Federation of Public Health Associations. Welcome to the 15th World Public Health Congress. And welcome to the world's most livable city, Melbourne. I just wanted to say that because I was hoping there'd be somebody from Sydney in the audience. In fact, Melbourne has just been named the world's most livable city by the Economist Intelligence Unit for the 6th year in a row. One of the reasons, one of the fundamentals behind that is access to good public health care. And as many of you would have seen, as you came in from Melbourne Airport and passed through the Parkville area, there is one of the world's great medical precincts. There's a fair argument that perhaps along with Boston and Cambridge, if you then combine Melbourne and Sydney together and think of them as a single medical research precinct, these could be among the world's great medical precincts. And that history is steeped in time. If you travel back to 1890, and if this Congress had been held in this city 127 years ago, the average life expectancy for women in the room would have been 50 years. For men, just over 47. Travel forward to today, to 2017, and the average life expectancy is 83 and more for women. For men, it's just over 80 years. It's a 33-year increase, and that is your doing and those who came before you. That is the work of the great public health advocates. That is the work of the people who have been involved in medical research and then the translation of that medical research to delivering the benefits to the people of the world. Real and systemic change that has transformed lives, has saved lives, and has improved lives. That is the tradition upon which this Congress is founded. That is the tradition of which you are the current custodians. And in the same way that Aunty Joy talked about tradition and carriage and future, this Congress today, this week, is part of the broad, grand sweep of global history, charting back through Murray Pasteur and through Fleming, and then in Australia's own case, Florey and Macfarlane Burnet and Elizabeth Blackburn and Fiona Stanley and Fiona Wood, great public health advocates and researchers. You now stand in their shoes, and that is a wonderful thing. In this case, in this country, our health system is built on 4 great pillars. Firstly, universal access to medicines and to the great medical professionals, our doctors and our nurses. In this country, it's known as Medicare and the Pharmaceutical Benefits Scheme. And each year our investment grows, as it should. And each year the quality of healthcare improves, as it should, with new drugs for cystic fibrosis such as Kalydeco being made available to beautiful young children, for the first time, new drugs for ovarian cancer being made available. These are the things which a good public health system should be able to provide for those who otherwise cannot afford it. But then we bring it forward to access to quality hospitals and to sustainable hospitals. And that's one of our great tasks that Martin and I and our colleagues between the federal and state governments are embarked upon in this country, making more places available for more people to improve their conditions. But our greatest success will be when fewer people are in need of those hospitals because they have been addressed earlier through genuine public and preventive health. And that's our third pillar. The third pillar of what we're doing in Australia is to focus on public and preventative health in the form of mental health, Indigenous health, and avoidable chronic disease. And we are embarked upon that process across the country. And our fourth pillar is the medical research, which will bring forward, along with many other countries and researchers from around the world, the next great wave of human history. And that is the precision medicine, which will allow us to decode the DNA, to sequence the genome, which is already occurring, but to make that available to individuals in each country and each place. So as where there is a scrambled DNA, where there is a code which is broken, we can unravel that and we can help repair it. And that will offer hope for people with motor neurone disease and cystic fibrosis and so many other conditions which until now had represented either a tragic sentence or a sentence of pain and loss of facility. And this threshold upon which we stand comes from the investment in medical research which is occurring across the world. So then we ask, well, what is it that we might be able to offer as an example, and an imperfect example admittedly, but as one country's example of its preventive health initiatives? And really our own preventive health initiatives come across four great fronts. Firstly, as Michael mentioned, immunisation. Over the last 18 months, we've seen our no jab, no pay system see an increase of 200,000 young children who have now been immunised. Our immunisation rate in Australia is 93%. The immunisation rate for those who are subject to this system of benefits being deferred or withheld if the parents choose to put their children at risk, it's 94.5%. So a genuine public health success. But we can do better, and now we are seeking to embark upon the next great stage of that process. Secondly, there's the work that's been done on tobacco. We saw from the President of Uruguay a real example of public health success. In this country, over 4.5 decades, we have seen our smoking rates plummet. We are heading towards the goal of 10% by 2018. It is still too high in Indigenous Australia, and that will be our focus going forward. But through a variety of measures, a combination of price, of education, and of restrictive packaging elements over many decades and public health warnings, we have dramatically reduced that rate. Still, 15,000 people lose their battle with smoking-related cancers and diseases every year, so we must do more. But we are making progress, and that is one case of one country making success a reality in this case. Then, of course, there is alcohol and drugs. This is a global challenge, and we know that in our country, 200,000 people at least are currently using and suffering from the impacts of ice. So one of the most profound of the methamphetamine family of drugs. And so right now, on this day, we are launching our new local drug action teams as part of a $300 million national initiative. And we'll be launching drug action teams to complement the law enforcement with the community engagement of working in our schools and our universities and our sporting clubs with young people. And then the last of the areas of public health in Australia is in relation to the question of what we do for healthy lifestyles. And with healthy lifestyles, what we are doing is investing in our schools to bring those disadvantaged children through the Sporting Schools program into the world of sports activity. Nothing unites kids more, nothing excites them more, and nothing brings them better lifelong health benefits than being engaged in sports activity. Add to that the guidance on eating. Add to that the work on diabetes, where only 2 days ago we made available in Australia for the first time access to continuous glucose monitoring for those type 1 diabetic children who otherwise would never have had access to it, which gives them the chance of a full life and gives their parents the chance of a night where they can, for the first time, sleep without fear of waking and sleep without nightmares that their child might not wake. So these are the things that we have done. We do that as a contribution because that's what a good society should do. We can all do more. We can all do better. That's one country's example of one way forward. This week, each of you are engaged in a great global task. When you trace back to Marie Pasteur and Fleming and, as I mentioned at the outset, Florey and Macfarlane Burnet and Elizabeth Blackburn, you stand in the shoes of those who have come before and you make that path, lay the plans, set the vision, embark upon the task. I thank you, I honour you, I welcome you, and I am delighted to officially open the World Public Health Congress for 2017.